Okay, so today we are going to cover muscles of the lower limb. Now, our muscles of the lower limb are also organized into groups, just like the upper limb, where we had an anterior and posterior compartment. But since your lower limbs are a little bit meatier, we actually have two additional compartments. We have not only an anterior and posterior compartment, but we also have a lateral and medial compartment. These muscles are going to move the hip, they are going to move the knee, and they are going to move the ankle and foot. So we're going to first take a look at muscles that move the hip. Now, the muscles that move the hip, as I mentioned, can be divided into actually 4 compartments, even though it says 3 on your PowerPoint. They are all going to originate on the ossa cocci and insert on the femur, which is how they're able to manipulate the hip. So, the anterior compartment will flex the thigh like this. The medial compartment will cause adduction, so bringing in. The lateral compartment will abduct the thigh, and then the posterior compartment will extend the thigh. So think of those motions at the hip as we're moving through these compartments. Okay, the first muscle that we're going to look at is the iliopsoas. And this is a little bit of a hiccup from what we just discussed when I said that all of these muscles are going to originate on the ossa cocci. Part of iliopsoas actually originates on the lumbar vertebrae, and that is psoas major. So psoas major is this chunk of muscle right here. And then the other muscle is called iliacus. And iliacus does originate on the ilium of the ossa cocci. And as they move past that inguinal region, they're going to come together and form one muscle known as iliopsoas. And that's going to insert on the lesser trochanter of the femur, which is why it's able to pull up and cause that hip to flex. So on our leg models, iliopsoas is this muscle right here. Next to it, we have the longest muscle in the human body called sartorius. If you ever listen to Notorious B.I.G., he has this song, Notorious. I cannot sing. But anytime I hear of sartorius, that's what I think of. So you can think of sartorius, which is notorious for being the longest muscle in the human body. Now, sartorius and rectus femoris are both going to flex the hip. The term rectus means straight up and down. Think of rectus abdominis with a straight up and down muscle in the abdominal region. Rectus femoris is also a straight up and down muscle, but in the femoral region. It's actually part of the quadriceps, but we're going to talk a little bit more about that later. It's going to originate on the anterior inferior iliac spine, so you can try to feel for that in your hips. And then it's going to insert onto the patella, and then from there, the patellar ligament will insert onto the tibial tuberosity. So what you're seeing here is the quadriceps tendon inserting onto the patella, and then from the patella, we have the patellar ligament inserting onto the tibial tuberosity. Now, looking at our medial compartment, so these are all going to be adductors, we have a tiny little muscle here that looks like a little chicken's beak, and chickens like to peck. So this muscle is called pectineus, and that's going to cause the lower limb to move medially, or adduct. Next to that, we have a muscle called adductor longus, which tells you again that it's going to adduct the hip. Now, looking medially, we can see adductor longus very clearly here, as well as another strip of muscle that goes right down the center of our thigh, and that is gracilis. Gracilis is going to insert on the medial knee, and it's going to again help to adduct the lower limb with the help of this big muscle called adductor magnus. Magnus meaning big, so big in fact that you can identify it in 3 different places. This muscle essentially is so big that when you adduct, it has to fold in on itself in order to fit in that area. Okay, since the thigh has 4 compartments compared to just 2, like in the upper limb, go ahead and maybe take some time and practice with the anterior thigh and the medial thigh. Maybe mute the video as you rewatch it and try to identify this yourself, or again, work on some labeling exercises. And then come back and we'll do the posterior compartment and the lateral compartment of the thigh. Okay, looking at the lateral compartment of the thigh, these muscles will be responsible for abduction, so moving the lower limb away from the body, and there's only one of them. This students often refer to as the latae muscle. It's called tensor fasciae latae. You may hear some people say tensor fasciae latae. Either one's fine. It's going to originate, though, on the iliac crest and insert on this structure here known as the iliotibial band or iliotibial tract. Most professionals just say IT band or IT tract, which will go on to insert on the lateral condyle of the tibia. Oftentimes, runners experience issues with their IT band, and because of that, knee issues. When your muscles on the lateral side of your thigh are tight, it will pull on this IT band, causing a strain on your knee. So oftentimes you have to get it massaged out or stretch it out in order to alleviate that knee pain. So that would be ID structure, and you would say IT band or IT tract. Okay, looking at the posterior compartment, these are your hip extensors. The most well-known one is the gluteus maximus. In fact, it is the agonist of hip extension, so it's the muscle most responsible for hip extension. If you ever see people in the gym, they're on all fours and they do like those kickbacks, that is working out the gluteus maximus. It's going to originate not only on the iliac crest, but also the sacrum and the coccyx. It's a pretty big muscle, so it needs lots of support for its origin. And it's going to insert on the gluteal tuberosity of the femur and even go down to the linea aspera. Now, if I were to pull off gluteus maximus, deep to that you would see gluteus medius and gluteus minimus. I don't have a picture of it here, but I do cover it in the model videos posted on Canvas. Okay, so go ahead and take some time, look over the lateral compartment of the thigh and the medial compartment, the posterior compartment of the thigh, and then when you come back, we'll take a look at the leg or the crural region and finish up with that. Okay, taking a look at muscles that move the knee joint or the leg, we are going to see two movements here. When we talked about the anterior thigh muscles, we said that they flex the hip, but they do the opposite for the leg or the crural region. So muscles here that flex the hip will actually extend the knee. They're going to do the opposite, and that's due to the rotation of the limb to make us bipedal, which means muscles in the posterior compartment of the thigh that extended the hip will actually flex the knee. So again, they do opposites. Posterior thigh muscles would extend the hip, but they are going to flex the knee. So keep that in mind as we talk about these movements and as we identify the muscles. Okay, so looking at the anterior thigh muscles that will extend the knee, we have the quadricep muscles. These are 4 muscles that will act on the knee from the front. So one of them that we've already learned is rectus femoris. Lateral to that, we have vastus lateralis. Now I'm going to jump back to this picture here, because here's the IT band. This muscle here and here are both vastus lateralis. It's a pretty big muscle. It's just partially covered by that IT band. Opposite of vastus lateralis, we have vastus medialis. And then you can't see it here, but if I were to take off this piece, which is the rectus femoris, you would see deep to that vastus intermedius or vastus intermedialis, depending on what textbook you have. All of these will insert on the quadriceps tendon, which will insert onto the patella, which will insert onto the tibial tuberosity via the patellar ligament. So again, in our model videos of the lower limb, I go through all of these muscles and pull apart the model so you can see them more clearly. So right there, that would be quadriceps tendon for ID structure. Looking at our posterior compartment, on the lateral side of the posterior compartment, we have a muscle known as the biceps femoris muscle. Biceps femoris makes up 1/2 of the hamstrings, which are typically considered the posterior posterior thigh muscles. Biceps means two heads, and femoris means femoral region. This one here is the long head, and unfortunately in this picture you can't see it, but the short head is down here by the knee. Again, in the model videos that I have posted, I show you exactly where that short head of biceps femoris is compared to the long head. And yes, you need to be able to tell me the differences in the heads on the exam. Now here I have a semitendinosus, which is superficial to semimembranosus. So here you can see semimembranosus peeking out on either side of semitendinosus, which is superficial to it. So again, these 4 hamstring muscles will work together to flex my knee. Okay, before you move on to other muscles in the leg that work on the ankle, if you'd like, take some time, go over the quads and the hamstrings again, and then I'll meet you back here. Okay, looking at the muscles of the leg, we have 3 compartments here. An anterior compartment, a lateral compartment, and a posterior compartment. And they each do different things. So the anterior compartment will be responsible for dorsiflexing your foot, which is this movement here. The lateral compartment will be responsible for eversion, so that's pulling the pinky out into the side. And then the posterior compartment will be responsible for plantar flexion, which is this, or pointing your foot. So that should say plantar flexion. So again, keep that in mind as we go through these muscles. Starting with the anterior compartment, this muscle that you see here that's more lateral, you'd be able to trace its tendons to the toes. This is extensor digitorum longus. We had an extensor digitorum on the posterior side of our antebrachium. This one is longer, so it gets the name extensor digitorum longus. Also note that in the forearm, our extensors were posterior. In the crural region, our flexors are posterior and our extensors are anterior. So again, I'll say that again. In the forearm, our extensors are posterior, and in the crural region, our extensors are anterior. So next to extensor digitorum longus, you have tibialis anterior. It's right up against the tibia, which is what you see here. And then in between the two, you have a tendon coming from a muscle that will go all the way down to the big toe or the hallux. And we call this extensor hallucis longus. So all of these muscles are going to dorsiflex the foot, or pull the toes upwards. Laterally, we have 2 muscles that will cause that eversion, that pulling outwards on the pinky toe. We have fibularis longus, which you can see here. And then towards the actual lateral malleolus and slightly anterior, you can see fibularis brevis, so a shorter version of that muscle. Lastly, our posterior compartment helps you to plantar flex or point your toes. The most prominent muscle here that makes up that chunky part of your calf is gastrocnemius. Gastrocnemius, I always think about, is the muscle you would activate when you press on the gas in your car. So gastrocnemius presses on the gas in your car. So that's plantar flexion, or pointing. It's going to originate on the condyles of the femur, and then insert on the calcaneal tendon, which will go on to insert on the calcaneus. Now, on either side of our model here, you can see a little bit of a sliver of a muscle. That is soleus, which is deep to gastrocnemius. I don't have the ability in this picture to pop off this part of gastrocnemius, but if you did, you would be able to see all of soleus deep to it. And then, up by the popliteal region, there's a little body of muscle here called plantaris. Plantaris is like palmaris longus in your antebrachial region. Some people have it and some people don't. Unfortunately, I don't know of a way to tell if you have it or not. Again, for this part, looking at the model videos where I'm able to manipulate the models a little bit better will really help you identify these, as well as the Anatomy and Physiology Revealed cadaver dissection tool on Connect. You'll be able to peel back the different layers of muscles and see how they lay on top of each other. Now, what we're going to do in the next picture is take off all of gastrocnemius and soleus and plantaris to see the deeper muscles of these calves, which we have 3 of them. This one here is known as popliteus or popliteus. Popliteus is in the popliteal region, and it helps to manipulate the knee. The next muscle right here is tibialis posterior. If we have a tibialis anterior, we should have a tibialis posterior. And then the last 2 mimic what we saw in the front. We had an extensor digitorum longus, so we have a flexor digitorum longus. We had an extensor hallucis longus, so on the posterior side we have a flexor hallucis longus. Now, these are tricky because if you look down at your feet, the hallux is medial and the other digits are lateral. So you would expect that the flexor hallucis longus would be medial because the hallux is medial. Well, this here is a left lower limb, and this is medial. It turns out, though, that this muscle right here is flexor digitorum longus, and the lateral muscle is flexor hallucis longus. I know, mind blown. They start off on opposite sides because once they get under the foot, their tendons are going to cross and end up where they need to go. So again, even though you would think that flexor digitorum longus should be lateral, it's actually medial, and flexor hallucis longus is the lateral muscle in the posterior compartment. Okay, that summarizes the lower limb, and that is the last major lecture for our muscle units. There's a lot to learn, a lot of resources for you, so please practice that labeling, manipulate your body, get involved in your learning, and things will more likely stick. If you have any questions or want to review anything, please let me know.